Alan, what's going on, man? How are you?
Doing good, Neil. Might go hit some golf balls later on this afternoon.
There's nothing for me to do except go for a walk with Chewy, and the problem is the weather is absolutely nasty out. So if I'm talking May 22nd, I'll be complaining about the heat next week. All right. So our topic today is the dark side of PBMs, exposing overcharging practices. This is really interesting, Alan, isn't it?
Absolutely. I never knew what a PBM was until about 2 months ago when I started researching all this stuff with healthcare costs. And they're called pharmacy benefit managers. They're third-party administrators between insurers, drug manufacturers, and pharmacies. Now, they were originally designed to negotiate lower drug costs and improve access, but they've evolved into a very powerful middleman, profiting from non-transparent, often corrupt pricing practices. Now, PBMs bill insurers and employees more than they reimburse pharmacies and pocket the difference. That's called rebate manipulation. PBMs push drugs with the highest cost rebates, not necessarily the most effective or affordable, to boost profits. And pharmacy steering. Patients are forced to use PBM-owned pharmacies, often at a higher cost and lower service quality. It's just unbelievable.
Yeah, Alan, it is unbelievable. And it's basically what it costs people is ridiculous. And we just got to be smarter at understanding this. And there's no way to hold them accountable, is there, Alan?
There's going to be, because there's massive lawsuits out right now against the big carriers. I believe United Health, Blue Cross Blue Shield, Aetna, Cigna, and their pharmacies because of overpricing. Neil, they're overpricing 20 to 40% of your regular healthcare cost. And it's been going on for years. And guess who gets to pay it? We do.
Absolutely. There is a real world impact to this, isn't there?
Absolutely.
So let's talk about specifically enough how can we be transparent with the PBM models?
What needs to be done, and some of the biggest ways that PBMs overcharge employees and insurers, they're spread pricing. PBMs charge insurance employers more than they reimburse pharmacies, keeping the difference, number one. They have a rebate trap. Again, like I said before, PBMs favor high rebate, expensive drugs over low-cost alternatives, driving up costs for patients and plans. Then there's a lack of transparency, as always. Contracts often prevent clients from seeing what drugs actually cost and where the money goes. And then it gives pharmacy steering. PBMs funnel patients to their own mail order of affiliated pharmacies, even when it's less cost-effective. Now, this drives up employer healthcare costs. Bankrupt's community pharmacies and leaves patients with higher out-of-pocket costs. It's all hidden in the fine print, buried in the opaque contracts. Spread pricing is when a PBM charges an employee $100 for a drug, but pays the pharmacy only $60 and keeps the $40 difference. Then there's a rebate game. PBMs favor drugs with highest manufacturing kickbacks, not the most cost-effective options, and the patients end up paying more, and smaller pharmacies get squeezed out.
Wow. And it's terrible to know what's happening and this corrupt practice. What can the consumer do to deal with this?
Like I said, they go through this stuff, but they got to do some research. But the thing is, we need transparency. It's plain and simple. Employees must demand clear PBM pricing models. State and federal legislation should ban spread pricing and require fair pharmacy reimbursements. And benefit brokers must be held accountable for pushing opaque PBM details. Corrupt PBM practices are draining our system and your wallet. If you're a business owner, an advisor, managing healthcare plans, now is the time to act. Contact a fiduciary. I'm a certified financial fiduciary. I understand the system now that I started studying it. I can fix it for you. But understand this, Neil. People with regular healthcare plans right now are paying 20 to 40% over what they need to. I've got a regular healthcare plan that will save you 20 to 40% just switching healthcare providers. Now, you may have been with your healthcare provider for a decade, 2 decades. It's time to change because you don't know what they're overcharging you. And then the other thing, Neil, what we talked about before, my preventative health and wellness program. Do you realize We have a program with 1,100 drugs at zero copay. 1,100 drugs. They've got a whole, my son is a type 1 diabetic. He used to have to pay $435 a month for his, and his disability is, I think, $1,500 a month. And 1/3 of it goes to his diabetes medicine. But now he can get all that for free. Zero copay. They've got a prescription assistance program where if a drug's over $200, they'll find, or someplace to where rebates or whatever. This one family, their son came back with a drug that cost $720 a month. That's a big nut to swallow. Now they got it with our program, through our prescription assistance program, it is $60 a month. That's a huge difference. And the chances go on and on.
And at one point, you think the pharmaceutical companies are going to be held accountable, and the PBMs and everybody. It's coming soon, right?
Yeah. In fact, President Trump last week announced it. But these lawsuits have been going on for quite some time. He said, we're going to have the most favored nation prescription pricing. Why should we pay 10 times as much as Canada does for the same drug?
And certain drugs, if it's an expensive one, bankrupt you. The amount of money.
I went on a trip down to Cozumel and every place down the Caribbean, and this one friend of mine wanted me to get his daughter's allergy medicine, which is extremely expensive in the United States and costs about 1/20th of what it does down there. It's just nuts.
It's just that process of price gouging in so many ways. But contacting you, you can help them, Alan.
What do you bet?
All right, so go to call them at 910-551-1046 or strategicwealthstrategies.com, or email them at strategicwealth at the number 0 at gmail.com. Appreciate it, Alan.
All right. Looks like we both had trouble talking today.
Yeah, this is Strategic Wealth Strategies Podcast. Guys, take care. Bye.